Welcome back. As we wrap up Breast Cancer Awareness Month this week, we're highlighting some of the resources available to women in the greater Lafayette area and really beyond. The YWCA Women's Cancer Program offers many treatment options for women, including services for those who are uninsured or underinsured. Here to talk more about all of the resources and the program offers is Heidi Kauffman, Director of the YWCA Women's Cancer Program. Thank you so much for being here. First of all, we were talking about how a lot of women think that they don't qualify, so maybe they might not even reach out for resources and help, but you do offer programs for those people.
Right, so our funders, like Komen Central Indiana Affiliate and the Indiana Breast Cancer Awareness Trust, which is those pink ribbon license plates you see, they want us to help women who are underinsured as well. So actually we help women up to give you an example, family of 4, we help women up to $66,688 of gross total income for her family. So I think a lot of women actually would qualify, but they don't think, they think they have to have nothing to call us.
They think they may overqualify. They're in that gap.
Right, and so it's really important that you just call and see if you qualify because I think a lot of people would. And what we pay for is we can help you with screening, but a lot of people are getting insurance now that should cover their screenings. And then they have a high deductible. And that's when they run into trouble because they can't go get their diagnostic procedures. And those are really important. And that's when they should give us a call.
You also offer resources for items that may not always be covered by anybody's insurance, right?
Right. So oftentimes, women who have a unilateral or bilateral mastectomy, their insurance does not pay for them to get a bra and prosthesis. And we get them donated, and we have a storage closet full, and they're not doing our storage closet any good. So anyone, we don't ask income, nothing. We want to give them away. If we have your size, we will give it to you. For women with a unilateral mastectomy, it's actually a medical condition. If you don't have your weight balanced, then your spine can start to curve. So it's a really important thing, and cosmetic is also really important for a lot of women.
What about there's been talk recently over at what age do you get checked? What is the appropriate age to do that? What do you have to say about that?
So I have 2 things to say. I'm not a medical person, so I don't actually answer that question. But what I do say is that the 2 things that make me frustrated about this mammogram conversation, the first thing is that there's breast cancer that isn't caught by mammograms. It's called inflammatory breast cancer, and it's often missed by both medical providers and by women, and it's very aggressive and very scary, and it happens to younger women, and it can look like a rash or a bug bite or your nipple pulling in or your skin changing. So there's that kind of, that doesn't even caught by a mammogram and that we need to be aware of. The second thing is that they always start talking about family history when we go over these guidelines again. Family history only matters if you have a family history. 92% of all new cases of breast cancer are in women who have no family history. And so that just confuses the whole issue all over again.
Well, thank you very much for your help and all of the support that you're giving to women in 23 counties around Lafayette.
Yes,
More information at WLFI.com.